All right, gang. Waiting for followers. Getting my live going. Oh, here we go already. Hey people, how are you? I'm in Long Island. I'm hoping the connection is better this time. We did boost some Wi-Fi, so I'm getting better at this thing. Today's topic is lower face and neck rejuvenation. This topic just never ever gets dull because it's a endless attempt to do non-surgical lifting of the lower face. If my arms look old today and peely, it's because I fraxeled my forearms. Gotta get rid of my sins for the summer. Hey gang, how are ya? So I guess it's stormy out. No really big beauty news, and we have enough people. Got over 100 people on. Let's get into neck and lower face rejuvenation. Now, really, again, as always, this is a non-surgical or at least a minimally invasive surgical discussion here. We all know the gold standard is lower facelift and neck lift, and all neck lifts are not created equal. Some people need to do the whole face, some people can get away with just the lower, and that is really up to the expertise of a plastic surgeon. My expertise is really in using all the various technologies, judging who's going to be the right candidate for what. And we all know if you only have a hammer, everything looks like a nail. And particularly with the lower face and the neck, one device or one treatment is not going to be ideal for everybody. So I really think the best predictor of success with lower face rejuvenation isn't someone who has experience with several technologies. And again, not everybody can come to PFRANKMD, but you really want to go to some place where there are more than one option. Because like with anything else in the skin, it depends on your age, the severity, your skin coloring, whether you've had prior surgeries before, and often the less invasive you go with technologies, the more you will require either several treatments or a combination of treatments, right? The more invasive you go is going to be more of a one and done. And a lot of the things we're talking about today do not knock out your opportunity to get a facelift in the future. We'll talk about that. As always, I'm going to give my spiel, then I'm going to answer a bunch of the questions that you guys sent in, really good questions, and then obviously I'll put it open to discussion as people are joining in. So, lower face and neck rejuvenation. You know, over the last 20 years, before a lot of the newer devices, short of facelifting surgery, people were using injectables, energy-based devices. And, you know, I think we're learning now after 20 years of FDA approval of various injectables that you can really only get so much. Fillers don't really lift. You can optimize the shape. You can reflate the face with fillers. They may give the appearance of a lifting effect, but you are not really lifting and cutting out tissue. And certainly some patients are going to get more effect of lifting of the jawline and lower neck with injectables than others. Someone with a roundish or fullish face, you're just going to look fat in the face. You're doing no lifting by using fillers, okay? But unfortunately, there's such easy access to fillers. Every med spa, every doctor in the country is doing it. They're not investing in technology. They don't usually have the skill or expertise to do combination therapy. So of course, fillers is always going to be sold as lifting. And although fillers are certainly a part, and optimizing the volume of the face is going to be important in creating a lifting effect, it certainly is being abused enormously. So please do not look at injectables as the sole way to do that. We use neurotoxins in the lower face as well for neck bands. But again, this is going to really address a milder spectrum. Over the last 15 years, there are a lot of energy-based devices that have come out. Thermage, which is radio frequency, Exilis, all therapy, which to me is the most potent, deepest, effective, and predictable of the purely energy-based, non-invasive devices. We have come a long way with these technologies, but again, you are not getting a neck lift with all therapy or Thermage. You are improving the elasticity of the skin, but you are not getting a neck lift. And any physician that wants to sell it to you as a non-invasive facelift is just pure outlining. Ultherapy, Thermage, these energy-based devices, they are part of the maintenance of keeping the elasticity of your skin healthy. Although they don't take an enormous amount of maintenance, we do continue to get older. A lot of my patients, including myself, get an Ultherapy once a year, and they are a complement to injectables. They are not a replacement, and when someone does need a facelift or a neck lift or something more aggressive with downtime, we certainly talk about it, or we send the patient to the plastic surgeon. There are a lot of new technologies out. People have been talking enormously about microneedling, energy-delivered microneedling. This is where needles, fine needles, puncture the skin, deliver radiofrequency heat. We can get some skin tightening from it. I do believe it is oversold. People are always asking me about Morpheus 8. This was one of the questions. You know, Morpheus 8 for Vivace, any of these energy-based devices, microneedling devices, they are not going to lift skin. They will tighten the skin superficially. They will improve crepiness of skin, but you are not getting shifting of tissue from energy-delivered microneedling. Although, again, they are a great part of the armamentarium in the overall resurfacing and tightening of the skin. We often use them for a little bit deeper tightening than what we get from Fraxel, which is more Fraxel Dual, which is more sun damage based. Again, anything we do to resurface the skin, deliver energy in the skin, get rid of the old, stimulate the new, is going to improve an overall tightening. But you know, I think when people say they want neck lifting, jowl lifting, they really are referring to an effect that when you take your finger and go like this. And for a lot of people, there is excess skin. And when there's excess skin, although we can do things to contract them, anyone you recommend for actual chin? No. Dr. Few in Chicago. He's my favorite plastic surgeon there. Someone was asking about Chicago plastic surgeons. Anyway, you know, these energy-based devices can only penetrate so far. And when people are wanting a neck lifting effect, there's often excess skin, so you have to do something more invasive. One of the biggest advances that I've seen in my practice in the last 10 years has been FaceTite. What is FaceTite? FaceTite is actually a device. It's made by InMode. It's an internal radiofrequency device. So instead of spending all this time injecting radiofrequency from the outside or totally non-invasively putting radiofrequency or ultrasound, we're actually doing it from the inside. So you're getting a much more surgical effect. Now, I've been doing neck liposuction and jowl liposuction for 22 years, and it is an enormous procedure for the right candidate. But not everybody is a candidate for straight neck liposuction. If there's any loose skin and the skin elasticity is not great, we need tightening or skin excision as well. That's really where FaceTite has taken things to the next level. And if you watched all my videos, FaceTite involves iron. You know, if this is the skin and this is the muscle and the fat's in between, the FaceTite goes above the skin and into the fat. And it's kind of ironing the skin. And this is the first stage of the procedure. Then I use a device called Vaser, which is an internal ultrasound device for additional tightening and to melt the fat layer. Then I'm going in with micro cannulas, removing the fat so that the skin is now opposed to the muscle, and then we put on pressure. And this is an hour-long procedure, people. I'm still amazed after doing it for several years at the surgical type result I get. Again, I'm not doing this on people in their late 60s, 70s. I'm doing this on people in their 40s, their 50s, good 60s. It's best that you have some fat in the jowl or in the neck. If it's just crepey skin, it's not ideal. And we're really attacking the fat layer, the deep dermis, the muscular laser, and I'm really combining several technologies in a simple procedure that's performed under local anesthesia. You recover very much like a dental procedure. We wrap you for 24 hours. That's it. Patients are awake. They go home in an Uber. There's no pain afterwards. And the only part that is at all uncomfortable is the 3 minutes it takes of me giving tumescing or giving Novocaine shots in the jawline neck area. So the ideal differential of this is someone that has fat in the neck with only mild to moderate skin laxity. And you could go see all my videos or on social media or go online. The FaceTite has really, really been a home run for my practice. So What's the next question, Dr. Frank? What do you do if you don't have fat and it's really just skin hanging? Well, if there's really, what people call a turkey neck, and it's like hanging, you can play with it. You need skin excision, you need muscle tightening, you really need a lower facelift. Now, I do have patients who fall into the category of not ready for a facelift, don't ever want a facelift or refuse to do it. There are people who have that. People that want to put it off for several years, or for people who really have medical issues. They can't go under general anesthesia. They have medical issues with healing that would preclude or prevent them from getting surgical. So, the most important thing in choosing the right candidate is not only whether or not they're physically a good candidate for it in the area, but are they medically a good candidate? Will they be cleared for surgery? I always ask someone, do you think you're a candidate for plastic surgery? And would you consider plastic surgery? And if they do, that changes my perspective on how I'm going to navigate the algorithm of finding the best treatment for them. Because I like plastic surgeons. They make my work look good. They always come back for Botox or fillers or lasers. Plastic surgery is not the answer to anything. So I'm always very enthusiastic to working with the right plastic surgeons, facial plastic surgeons, to really get the best result for the patient. But if patients, like many of my patients do, fall into the category of like, I don't want, I can't do, or I'm just not doing it now, then we talk about the other things. So for that patient who just has loose skin, groundbreaking thing in just the last several months is Ellacor. And so many of you have seen me demonstrate Ellacor online. I'm doing this procedure like crazy now in my office. And this is the first category of technology called fractional microcoring. We're learning so much about it. And it is a way of extracting and cutting out skin scarlessly. How do we do that? Almost in a pixelated manner, we are coring out little microcores of skin under local injectable anesthesia. So again, like my face type procedure, you inject local anesthesia into the area. This is the most common area. This is the common area. And I'm taking this out because I'm getting this done in November, guys, because I do not have fat. I just have a little bit of skin. So I'm going to be your guinea pig. You'll watch it probably over Thanksgiving. Anyway, this device, it is not totally non-surgical. You have to inject anesthesia. There is some downtime. It takes 24 to 48 hours for those 10,000 little micro channels to close up, because you are cutting those out. A vacuum is sucking them into a machine and going in the garbage. The holes close up in 24 to 48 hours. Women could then put on makeup. And then you're just red and puffy for several days. It is not no downtime. It's really a week before you're perfect again, but you can put on makeup at about 2 days. Men can grow out their beard. And it is performed 2 or 3 times. We are seeing surgical results, people. We're not seeing neck lift type of surgical results, but we are definitely getting great results, and we're starting to use it on several areas of the body. That's for another conversation. So that has really made a very big difference. Also, M-Face, on the total other side of the spectrum. M-Face just came out. Again, all these devices, me are so excited at PFRANKMD to be involved in their development, in their release, and in really helping the companies optimize and navigate the procedural techniques to really get the best result. And I worked with BTL with M-Face. M-Face is basically M-Scope for the body, except it doesn't use magnetic technology. It uses electric stim and radio frequency technology. And right now, we're using it on the brows, and we are using it on the zygomaticus major and minor, and it is lifting, okay? You are getting some jowl lifting here. It is totally non-invasive. It works on the muscle. It works on the skin tissue. It's a great procedure. It is a complement to everything else we're doing. It's definitely on the non-invasive scale. There will be maintenance, but again, for those younger patients who want to be proactive, for people who want to are a little shy about bigger procedures, that want to minimize injectable maintenance, M-Face is great. And again, on the lighter spectrum, for that, the psychology of a patient who wants to do small things, non-invasive, very low risk, no downtime, M-Face is an amazing addition to our armamentarium. I'm looking at my list down here, guys. CO2 laser resurfacing. I get some great results with the Fraxel repair on neck tightening. I have before and afters, which you've seen before. I will show again. There are a lot of people who get neck lifts and they still complain of crepey, loose skin down here. Nothing works better than CO2. And I'm going to repeat this again. Nothing works better. Not microneedling, not the lower Fraxels like Fraxel Dual, not Ultherapy, not Thermage. Fractional CO2 resurfacing. It works more superficially, but it works beautifully to tighten crepey skin. Fine lines and very superficial jowls, crepiness and thin skin on the neck. It does work more superficial than Ellacor. It is a great complement to facial plastic surgery, although, again, I would be wary about a lot of plastic surgeon colleagues of mine do it during a facelift. I believe they are appropriately more conservative because the way I would do CO2, I think, is too aggressive to do during a neck lift because of the amount of swelling and risk for infection that it would induce. I've never seen an infection when you do it alone, but I'm concerned about the risk of infection of doing it that strong with a neck lift. So it's a really great independent procedure. Someone had asked a question about what could I do to maintain I'm going to get to the questions in a second. What could I do to maintain a facelift that I've had in the past? CO2 laser resurfacing is a great superficial tightening. It is a week of downtime before you could put on makeup. I do put patients under twilight for it. Anyone that says they could do it with topical anesthesia didn't have real CO2. Anyone that says they did it with nerve blocks and topical anesthesia, injectable anesthesia, in my opinion, didn't have real fractionated CO2. The manner of which I do it, which is quite aggressive and very effective, I honestly believe you have to be under twilight for it. You don't have to be under general anesthesia, but you do have to be on twilight. Someone is saying Sculptra over there. Again, Sculptra, like all fillers, is reflating the skin. It is not going to lift. It's not going to remove skin. Be wary of fillers and the sell of people saying that fillers are going to lift. Lifting fillers. You know, I love a good filler in the jawline. I love radius. I love a little bit in the malar fat pad and cheek in someone who is hollowing out and has the anatomy of a deflated face. You will get the appearance of lifting then. But someone who has a fuller or roundish face, you are just making that face fatter and wider. You are not lifting with those injectables, people. CO2 laser resurfacing, again, is also getting rid of sun damage and fine lines and tightening the skin in a way that you'll never get with surgery. And I am finding now, I do have patients where I've done CO2 laser resurfacing and Ellacor. Again, these are older patients who really are not going down the surgical route. CO2 laser resurfacing and Ellacor, I think, is going to be an amazing combination, people that I'm working with to figure it out. Again, nothing is one and done. And as opposed to plastic surgeons who may see a patient once or twice in their life, people who come to PFRANKMD, they're really on the journey with me. I hope to grow old gracefully with all of you who do come. And I really think it's about making a short-term and a long-term game plan, figuring out what your expectations are, figuring out what your game plan is long-term, what you'd consider, things like budget, things like downtime, what your head frame is. You have to get to know your patient as a cosmetic dermatologist because it is not a one and done thing. And I really have felt I've built great relationships because my patients ultimately will say to me, "Doc, what do I need next?" You know, when you feel like someone understands where you're coming from. And sometimes you have to, every few years, you have to change the conversation and be like, there are new technologies, people do think differently, things that they said they would have never done in the past. They now say, let me see, do lasers help come back of facial nerves after facelift? No, they do not. You know, there are, one of the major risks of facelifting surgery are damage of the nerves. And yes, any surgical procedure can do that. Even face tight, there are some risks to nerves, but again, we're not cutting tissue. So even in the worst case scenario, any nerve damage is temporary. We've never seen any permanent thing. You know, facelift surgery does have more risk. That's why I only send to facial plastic surgeons. You want people who do this all the time. You want liposuction, you go to someone who does lipo all the time, right? You want facial or lasers or injectables. So it's important you balance very carefully the risks and benefits, right? If everyone says, oh yeah, facelift gives the best results, then why not everyone just do a facelift? There's always a cost benefit ratio. Threads, thank you for someone bringing this up. Thread lifts. Thread lifts are great for people who can't do a lot of injectables. They have rounder, they have fuller faces. I usually use threads and energy-based devices like All Therapy for people with fuller faces. You know, Ellacor is not going to be ideal for people with full faces. Again, it can help a little bit, but I'm looking more for that superficial crepiness of skin and looseness or a little bit of grab. People who are just fuller or heavier are going to require either surgery or a combination of energy-based devices like All Therapy and threads. So what do threads do? And again, a lot of people have impressions about threads. I use barbed PDO threads. The other category are the cone threads, which the silhouette. For me, in my hands, I know Dr. Julius Few in Chicago is amazing at them, but I find that there has to be a balance between the downtime and the benefit. And for me, I find the silhouette threads to be too aggressive and not enough benefit. The PDO threads that are barbed that I use work great. There's really no downtime. People go to work the next day, maybe have a little bump out here. I do it under local anesthesia. The trauma is really not that much more than a day of injectables, some Botox and fillers. They complement other things that I do. I'm sorry, surgery is the way to go, long lasting. You're right, surgery is the right way to go for the right person, and it is the longest lasting, but it is also the riskiest, has the most downtime, is also by far the most expensive, and it also doesn't mean you're done with the dermatologist, because I'm sorry, no matter what you say, some people who still need fillers, they still need neurotoxin, they still need laser, and the type of person that is willing to go through the downtime, risk, and cost of a surgery, chances are they're high maintenance enough about their looks that they're going to want or need some other follow-up in the past. So I'm not saying that they still don't need it. So thread lifts, it takes me 15, 20 minutes to do, and it's really just for that patient that's looking for that little bit of lift. Okay, it's not going to excise skin. I complement them with injectables. I complement them with energy-based devices. They are not a replacement, but man, for my patients that are great candidates for threads, they love them. They're shocked in how little downtime. They're shocked in how much result they get. They can do it every 12 or 18 months. Sometimes I'll do a 12 or 15 thread lift, and then maybe 6 months later, they just need half or a third of that. So threads are really great. Most patients are candidates unless they have loose skin. And again, I tend to do it on fuller face patients who are afraid of doing too much injectables. Let me go through, I'm already 25 minutes in, guys. I'm only going to do this for about a half hour. I do appreciate your attention. I'm just going through some of these questions. Oh, can people do facelifts doing all this stuff before? Is it going to hurt them? This is a great question. I mean, listen, I wouldn't do threads if you're thinking about getting surgery in the next 6 months, right? You definitely don't want to do a lot of injectables within 3 months of surgery. People with energy-based devices, All Therapy, Thermage, these are all great as long as you don't abuse them, right? You could do All Therapy once a year. I mean, if you're doing All Therapy 3 times a year, it can become abusive, all that energy. Plastic surgeons, good plastic surgeons, most of their patients have done all these things prior. It's very rare a patient does absolutely nothing and then they go to a plastic surgeon at age 50 or 60 or 70, right? So a good surgeon is going to be adept. And anyone that totally poo-poos the things that dermatologists do, I think they're doing themselves a disservice. Either A, they don't know how to deal with the tissue, or, they're just not in healthy competition, right? Because it's a concerted effort between what I do and what plastic surgeons. And the plastic surgeons I work with, like Dr. David Rosenberg, Dr. Andrew Giacono, we work in unison and we make a game plan for these people. But yes, there is abuse. And certainly one of the procedures that I find is one of the few things that could damage the ability to have a good facelift is Kybella. People are injecting Kybella in the neck and the jowls. I find when I do neck liposuction on all the patients that failed Kybella, it is so much scar tissue and it makes a complete mess. Kybella, I think, is poison. I'm sorry for those of you out there who use it. It causes an immense amount of scar tissue. Half my patients that come to me for neck liposuction have wasted thousands of dollars, many of them have irregular skin at the best case scenario, have had no results. And I think it actually serves the patient to a disservice if they're going to do surgery in the future. I have not found this with threads. Occasionally, one of my plastic surgery colleagues will show a video of them pulling out one of my threads out of the skin. Listen, the threads dissolve in 4 to 6 months. I'm not doing a thread lift on patients within 6 months of the facelift. But sure, a suture could be underneath there. But these sutures are the same as any surgery. Hey, what's up, Joey? So I don't think they're a disservice, any of these procedures, as long as you are not abusing non-invasive. When it is time to refer to plastic surgery, it is time to refer to plastic surgery. And when I find things of the non-invasive or minimally invasive nature are becoming a law of diminishing returns, it's time to have that talk. And that talk may be, it's time for you, are you open to plastic surgery? That talk may be, we may have to change our expectations. Sometimes it's about, let's increase the frequency or the dosage or the amount of what I'm doing. Sometimes the conversation is, let's try something new because more of the same is maybe going to make you look fake or not work. And sometimes that conversation is, listen, guys, we're all aging. We do have to accept the aging process. The goal is never to look 30 years younger than how you look. We want to look great for our age. Aging is a blessing. So we have to unwrap our mind out of the concept that we're trying to escape aging. We are not. We're just trying to do the best job we can. And that's true cosmetically, nutritionally, athletically, personally. We're trying to, live the journey, enjoy the ride here, the pro-aging lifestyle. And sometimes, I have patients now for 22 years, and God, the technology and the things we're doing, I can do things now that I couldn't do 5 years ago. And it's an amazing journey, but sometimes every once in a while I have to have, not every once in a while, every day I have to have the conversation. Sometimes we have to accept certain things, and we have to lay out the algorithm of how we're going to move patients in and around to ultimately get them to the end goal, which for me is someone that feels good about themselves. And my part is on the look good, feel good part. I try and guide people towards other experts in fields of health and wellness, but ultimately I'm on the look good, feel good part. And there's so many amazing treatments out there, and understandably, we are human. We look in the mirror, we feel judged sometimes for the way we look. We often will not see in the mirror how we feel inside, and there's a huge feedback mechanism. So part of my job is to try and work the algorithm, hack the system as much as possible to help people feel good. And really a combination of all these types of things is great. We talked about Morpheus versus Vivace. I have 4 different microneedling devices. Everyone is big on Vivace. On Morpheus 8 now because celebrities are doing it. But I love Morpheus. I find it's actually better for the body. I like the Morpheus, the Vivace device better. I find it's a little bit more versatile in the settings in terms of the various depths I could use, in terms of the energy settings and the pulse width. Morpheus is a little bit more archaic. I'll use it surgically when I'm doing my face type procedure. It's a great post-treatment right after and a few times after that. Vivace, actually, another amazing device that's coming out this month that PFRANKMD and myself have been involved in the launch and development on. The new Vivace is coming out, guys. I'm not even sure I can give the details of it yet, but it is a 2.0 version of energy delivered microneedling that we have not seen before. Much more precise, much more variable, and I think is going to really kind of up our energy delivered microneedling game. So I'm super excited. Stay tuned for that in the next couple of weeks. I actually think I'm going to be able to talk about this next week. The new Vivace Ultra. All right. We talked about scarring. We talked about maintenance after facelifts. A lot of people years later, people get, again, it's not the surgeon's fault. It's often just the nature of surgery. Patients will get lipoatrophy laterally in their face. They'll almost lose the definition here, either right after surgery or after, and that's an appropriate time to re-volumize. Radius, Sculptra, hyaluronic acid. So again, these are great maintenance for even after to keep the facelift alive. Anyone surgeon that says a facelift is permanent, they're lying. We do continue to age. We are redraping the muscle. I'm not, but surgeons are redraping the muscle and the skin, and there are things we can do to maintain that. Laser resurfacing, whether it's non-ablative or ablative. Volumization. Fillers in the neck. Oh, this was a great question. Are there any other treatments for neck bands, vertical neck bands in the neck, other than surgery? The answer, no. Only Botox works on those vertical neck bands. They got the monopoly. And yes, it doesn't last as long as Botox up here. Yes, it does take a higher dose. But for the right patient, not only does it make the bands go away when you talk or express yourself, but it definitely does. Oh, my pleasure. Someone was thanking me for doing this weekly. I love it. Anyway, Botox or other neuromodulators are the only thing. I actually love Dysport in the neck, people. I don't get paid to say that. But you need higher doses. Anyone just dabs a little bit in the neck, you're not going to get a good dose. You have to make sure you get into the bands. It's a low-risk procedure, but if not done right, it's not going to work great. As for MSA, is it normal for the top to pull to one side? It shouldn't pull to one side if you have the energy set appropriately. Anyway, back to Botox. So yeah, they got the monopoly on the vertical neck bands. On the horizontal neck bands, you know, microneedling helps, CO2 helps, anything superficially resurfacing for the texture is going to help with the horizontal neck bands. But there's only one thing that really does it, and that is hyperdilute hyaluronic acid fillers. I put Belotero there all the time. People have done so many energy-based devices on there, and it makes it 10% better. You put a couple of syringes of hyperdilute Belotero with my kind of stuttering technique that I actually posted the other day, giving away all my secrets. And it gets rid of it 75%. So horizontal necklines, filler, vertical necklines, neuromodulators. And guess what? Neck lift doesn't fix those lines, guys. And I've seen the majority of neck lift patients who had neck bands before still have some neck bands after. So yes, you still have to do it. Again, beware of the plastic surgeon who says you will never need the dermatologist again. I am not just saying that because I need you to come back to me. I am saying that because it is true, and you could ask any of the doctors that I work with. They will all say, get back to Paul, because they want their work to be maintained appropriately, and the things I do are going to prolong their work. And yes, there are sometimes people that go back for second facelifts. It's a long life, guys. Calling tomorrow for a fall appointment. Oh, that's nice. Not going to talk about melasma. Sorry about that. Not today. Okay, we talked about that. Fat necks. I love a good fat neck. As long as the skin isn't too loose. You know, my tumescent liposuction procedure of the neck and the face tight, I got to tell you, I do challenge the plastic surgeons. I get a great result, people, and it really does make a big difference. I think that's it, people. Man, we talked about it all. Face tight, Vivace, microneedling. We talked about fillers, what to do, what not to do. CO2 laser resurfacing, all therapy and thermage. We talked about threads. We talked about M-face. We talked about Eloquar. Oh my God. Maybe it should be easier to just become a plastic surgeon and just do 1 or 2 procedures, because I got a lot going on. But to me, that's the fun. I like having a lot going on. That's the summary. I specialize in the minimally to non-invasive. I try and stay in my lane. I try and refer out when I think it's beyond my level of expertise, when it's beyond what I could accomplish to match the expectations of the patient. And really, it's super fun for me with all these devices and techniques to navigate and optimize the best results for a patient's needs. And of course, I am my best guinea pig. So you'll be seeing me do some of these face tightening procedures on myself. I will be doing a little Eloquar. I may do a little CO2 tightening around my eyes this fall. I am doing M-face. So I'm watching out for you guys. If I'm watching out for myself, I'm definitely watching out for you. So thank you all. I don't see any final questions. I kept it under about 35 minutes. So peace out. Hope you managed the storm a little bit. It was a little blustery today. And we're back in action this week. See you later, guys.